All right, hey, everybody, this is Dr. AnthonyChaffee here with my good friend, Dr. Pran Yoganathan. He is a gastroenterologist and hepatologist over in Sydney, and we recently did a carnivore versus vegan debate where we were on the winning side. If anyone would like to go back and see that or has seen that. Pran, how are you, sir? Thank you for coming.
Very good, Anthony. Thanks for having me on your podcast.
No, not a problem. Your volume is a bit low. Are you able to?
Second. How's that?
Much better. Yeah, that's perfect. Great.
Perfect.
All right. Well, yeah. Well, thank you very much. Can you let us know? Like, obviously, you're a gastroenterologist, hepatologist. So, if you can just tell people exactly what that is, if people don't know, and also, you have your own practice, and as you've explained to me, you do things slightly differently than other gastroenterologists, and so forth, incorporating in lifestyle changes in diet and so forth to help your patients directly, as opposed to interventionally.
Yeah, thanks, Anthony. So I'm a gastroenterologist, and and in our practice, the vast majority of what we see tends to be irritable bowel, what's known as irritable bowel syndrome, which is fundamentally a diagnosis that a lot of people struggle to understand, including the clinicians themselves, as to what it is. Because fundamentally, what it means is that structurally there's no problem within the gut, and we can observe that as gastroenterologists because we do these endoscopic procedures such as endoscopies and colonoscopies. We can see real time that the gut structurally looks normal, or macroscopically looks normal, even microscopically on the biopsies, but the person's still left with symptoms. So the way we used to kind of manage, I used to manage it, was just the classical way, which is, well, there's nothing wrong with you. Go and see a dietitian about utilizing a diet such as the FODMAP diet, which is a diet that looks to restrict certain food groups. A very confusing diet in my own opinion. So I just found myself becoming a little disheartened with practice, because we would do these scopes, do these procedures, and then really not fix the person's issues. And I think that kind of led me down a pathway where I started exploring the concept of nutrition, trying to understand and comprehend what adequate nutrition means and how that might impact on the gut and also the liver, which is part of our specialty as well. So I think over time it's kind of evolved, Anthony, where I've started working with some fantastic dietitians team called Ellipse Health, led by Jessica Turton. And a group of fantastic dietitians, and we've just merged our practices, and I think we try to aim to provide this holistic care where it's doctors and dietitians working together to fundamentally combat a lifestyle-based issue brought on by diet.
Yeah. Well, that's awesome. So, like you're saying, irritable bowel syndrome. This is something that I know so many people that have struggled with as well. And like you say, there's no sort of clear answer, heretofore that says like, okay, well, this is your diagnosis, here's your pill, because that's how a lot of people look at it, especially with medicine. They say just, okay, there's something wrong with me, there should be a pill to fix that. What has been your experience with this sort of, issue, addressing this stuff, more from a dietary point of view? Are you getting good results, or are people happy with how things are going? Do you need to incorporate anything else apart from diet? And what sort of dietary changes do you have them do?
Yeah, it's fascinating, Anthony. I mean, the classic paradigm that gastroenterologists are taught from a very early stage of our careers is you do the scopes generally, you exclude disease, and then you work down this paradigm, okay? And that paradigm generally looks like a dietetic review for a low FODMAP or a dietary modification. And when patients get poor adherence to that diet, because it's a very difficult diet to adhere to, and we can talk about that later, the low FODMAP diet, if they fail that, then it's on to the next drug, antispasmodics, proton pump inhibitors, all drugs that were designed to be used for very short term, classically decades ago when they were bought out. And then once you fail that, which inevitably a lot of people do, it's onto the antidepressants, because we know there's a very powerful gut-brain axis. So we start blocking the neurotransmitters using SSRIs and tricyclic antidepressants. And it's really a bit of a mystery how how it works at a gut level, but they do. But fundamentally, we just blunt the symptoms that people are getting with these drugs. And I was very uncomfortable with that. I don't think in my entire career as a gastroenterologist, I felt comfortable with prescribing a tricyclic antidepressant to treat gut symptoms, and when you dig deeper, you realize it's very much a dietary issue. I think to answer your question of what is it specifically that's doing it, I think that's a difficult one, and it's a multi-layered question. It's a really difficult question to answer, but I've made this point numerous times that our microbiome with every generation sort of fundamentally deteriorating, and so it's like it's thought that the baby inherits the gut microbiome signature, or the gut bacteria, as it makes its way through the birth canal from the mother, right? And with babies that are born in a cesarean fashion, it takes a little bit longer to seed their gut microbiome for obvious reasons, but it eventually happens anyway. But if what we're inheriting from our maternal side is already flawed because the maternal microbiome has been exposed to this environment, right, that we hypothetically saying is so problematic, it's like the baby's set up with a poor gut flora or gut microbiome from day dot, and it sort of goes from then, and the baby's exposed to the environment as well. So it's not a clear-cut answer, because I think there's this deterioration pattern that we're seeing. What drives a poor gut microbiome? That's difficult to know. It could be the quality of our drinking water, which I think is very mineral poor, probably very chemical rich, one would have to think, because it's treated with various agents. It's going through plumbing that is old, potentially problematic. Additionally, we've got this really hyper-processed food environment, which I think is the biggest driver. Additionally, there's other factors like exposure to childhood antibiotics, repeated courses of antibiotics. It's not unusual to see people prescribed antibiotics for what is fundamentally a viral infection. You cannot tell me that is not common. That is a extremely common scenario, and we know antibiotics don't work in the setting of a viral infection, especially for upper respiratory tract infections and so forth. And so I think we're overusing these antibiotics, and so we have this perfect storm, really, where the gut flora, which is thought to be this really critical aspect, this symbiotic relationship between a human being and these trillions of bacteria that inhabit our gut, that symbiosis is somehow disrupted. And I think that is at the heart of what drives modern illness, to simplify what is a complex issue, of course.
Yeah, and absolutely. And there's been a lot of talk on the gut biome, especially recently, because people are finding this is much more important than we previously thought it was. And obviously food, whatever you eat, is going to feed the different gut flora, and your gut flora can be changing constantly, and that can affect things on a broader scale as well. Have you done much work or looked into the gut biome on the different diets, as far as like a meat-centric diet versus a plant-based diet and so forth, and these hyper-processed, carbohydrate-driven diets, and how that affects the gut biome?
Really good question, Anthony. Really good question. I think it's, again, we've got to sort of unpack that question. If you look at the data, the standard literature, there is no doubt about it. There's an overwhelming body of evidence that says, well, meat's bad for the gut microbiome. Okay, full stop. That's I think you'll agree with that, right? It's a very popular narrative, but I think it's important to unpack the package in which the meat is being delivered to the individual, the food matrix in which it's being delivered. There is no doubt that vast majority of our dietary protein is now coming from hyper-processed meats, right? That accompany other hyper-processed foods, other hyper-processed carbohydrate and fats, things like a meat lover's pizza, for instance, that would be deemed a high protein dish, high meat heavy dish, but you and I both know that is a very low protein, high fat, high carb meal, which is an absolute disaster. So in these epidemiological studies that are often carried out in nutrition, whether that's on metabolic parameters or gut microbiome, they use questionnaires to then determine, well, how is this type of food changing a person's gut signature? And if they're utilizing food such as that, which the vast majority of the Western world eats, then we've got an issue whereby you'll find that of course, that those sort of diets which are high in meat associated with poor gut microbiome signatures. I think there's a large body of evidence that suggests that hyper-processed foods are fundamentally the issue. In a condition called Crohn's disease, which is inflammatory bowel disease, there is a diet that's utilized in pediatric populations. It's not so much applied in the adult populations because it's very difficult to get adults to adhere to a diet, whereas children, you can get them to adhere through basically supervision because they're very dependent on the caregiver or institution to be fed. So they get better compliance out of kids, obviously. So it's been well studied in kids. And it was shown this diet we call the specific carbohydrate diet, which doesn't eliminate carbohydrates, it doesn't eliminate fats, but essentially gives it to them in a package that is whole food based. So we're talking very high protein, whole food carbohydrates, whole food fats. This dietary modification's got the ability to help not put the Crohn's in complete remission, but in some cases it did, but it has got the potential to help those from a symptomatic, endoscopic and biochemical potential or biochemical perspective for the inflammatory bowel disease. So it shows you that the inflamed situation that we find ourselves in, not just from a gut perspective, but just from an overwhelming systemic whole body perspective, is very much driven by this hyper-processed food environment. I think that is what we should point our fingers at and blame instead of any specific macronutrient, I think.
Yeah, I would agree. Yeah, a lot of these epidemiological studies, obviously, they look at broad sectors of people, and anytime they're looking at the meat cohort, they say it's self-proclaimed, like I eat more than 5 servings of meat a week or something like that, and they extrapolate all this nonsense off of that and blame it all on meat, when obviously there are a lot of other confounding factors. You mentioned Crohn's disease. Obviously, this is IBD is a major concern in gastroenterology and just in the world in general. Is a very, very serious disease. Crohn's, ulcerative colitis cause a huge burden of morbidity in people. Is this something that you see in your practice as well? Is this something you've been able to address with diet as well as the more standard traditional treatments?
Yeah, absolutely. Anthony, when I first started off training in gastroenterology about 13, 14 years ago, inflammatory bowel disease was a rare situation, relatively rare, right? Where you'd see these occasional young patients come in with absolutely catastrophic bowel inflammation. They'd spend weeks in there on various cocktails of drugs, high dose steroids. You'd watch them deteriorate because of the catabolic effect of steroids, and then eventually have their bowel out. Now, that was a rare situation. A lot of us as medical students or young doctors or young gastroenterologists, we would be using that scenario as a test case. We'd be taught around that case by our seniors, and you often felt quite bad for the patient because you're in there getting stories from them if they're willing, of course. But you saw those sort of cases very infrequently. Now I can tell you on a gastroenterology ward amongst most tertiary and even sort of primary secondary institutions, this is a much more common scenario. And that's just not my anecdotes. You can look at the statistics to see that inflammatory bowel disease has just exploded upwards. The incidence and prevalence, disease burden of that is absolutely enormous. And again, this is part of the reason we went down this pathway of looking at lifestyle, because I just couldn't contend with the fact that we were bringing out all these new drugs, these biologic drugs that are very novel, very clever drugs. However, they cost tens of thousands of dollars, and we're bringing new ones out every year and utilizing them without questioning, well, why is it the disease is becoming increasingly prevalent? Why is it that this is occurring? It's like there's no attention being paid to the fundamentals, and so to diagnose inflammatory bowel diseases, it's so common now in a gastroenterology practice, and we see some severe cases. Luckily, we've got these biologics, these brilliant drugs that work very quickly and help put a lot of people in remission, but the cost and potential side effects of these drugs may be quite significant later down the track. We know that the cost is significant. We don't know about the side effect profile longer term because, I mean, some of these drugs are quite novel, but from what I've seen, they're miraculous. But when does it stop? We've got a system that you and me know is already buckling under the economic pressures of just chronic illness, aging, inflationary monetary pressures. We can't just keep throwing drugs at a disease that probably has its roots in lifestyle. It has to. Our genetics cannot shift that quickly within a decade to account for this rising disease. So when you start looking at a big picture view and you start thinking, well, what is it that's changing in our diet? You have to look at the process component. We're moving away from a diet that is ancestrally and evolutionarily consistent for us. And I think therein lies the fundamental issue.
Yeah. And that's, I run into this every now and then, especially when I was first sort of going down this track of noticing that these diseases and so forth have become much more prevalent. And, this was right around the time we fundamentally shifted away from meat and fat, because of the whole cholesterol scare. And so many people would say, well, this was probably happening in the same numbers. We just didn't notice it. We just didn't notice it was in the background. We didn't notice the autism. We didn't notice the dementia. We didn't notice the Crohn's and ulcerative colitis and all these sorts of things. Does that hold any water as an argument?
No, because these presentations are catastrophic. You just have to live a day in a person who suffers inflammatory bowel disease, even if it's a very mild inflammatory bowel disease, to know that these people suffer. They go to the toilet multiple times a day, they get abdominal pains, they have low quality of life, they get chronic fatigue, they bleed from their bowels. Some of them end up with catastrophic surgical procedures because their bowels block up. So to those doctors and health professionals that say, well, we just didn't notice it before, I call ignorance on that, and I call a lack of humility to the suffering of the population. I think there is no doubt in my mind, and it sounds like it's the same with you, that these diseases did not exist to the same scale as they did in this modern world. I think there's no doubt autoimmunity and autoimmune illnesses have existed in history. There's bones of an 8,000, 10,000 year old human that shows that rheumatoid arthritis was starting to become prevalent, in particular in the agricultural era. Interestingly, there is no rheumatoid arthritis noted in the fossil records prior to the advent of agriculture. Some might say, well, fossil records from back then are around. That's true, but so many things start occurring after agriculture: the diminishing of skull capacity, the deterioration of dentition, which we know is a sign of systemic inflammation. I think the fact that we as doctors and health professionals sometimes fail to acknowledge that the evolutionary pressures under which we have evolved for millions of years are probably the most suited to us, to exist in. But of course, in modern civilization, that's very difficult to do. So I've sort of gone off track there, Anthony. But to answer your question, I think these diseases, there's no doubt that statistically are becoming more common. I mean, for us to suggest that dementia wasn't picked up before, and that's why I wasn't diagnosed, I think does a disservice to those suffering dementia and to the family members affected with loved ones suffering dementia. It's an absolutely horrific illness, and I think we should be paying more attention to these rising rates.
Yeah, I absolutely agree. I mean, I think it's it just shows a bit of conceit, that anyone born before 1986 was just couldn't see, couldn't see a barn door in front of them. Obviously, these things are hugely detrimental, and then people will argue, well, people are only living to 36 and so forth, and so they just weren't getting to the age of dementia and so forth for these diseases to present. But of course, we know that's an average from birth, and that's only because there was infant mortality was so high, but actually people did live older, and we have a lot of, Socrates was in his 70s, and that was thousands of years ago. So Marcus Aurelius and so forth, very, very famous, figures throughout history. We know that they lived to great ages, and we don't, they weren't in, old folks' homes and so forth. So, talking about, autoimmune disease and so forth, you mentioned that there was a specific carbohydrate studies with children that showing they had, good results for the gut biome and so forth. There are other studies such as looking at elemental diet and fasting mimicking diets and so forth. And this showed pretty good efficacy in treating Crohn's and ulcerative colitis, and sort of getting people out of acute flare-ups and also keeping them in remission as well. Do you know anything about that?
Yeah, I think Anthony, with the fasting mimicking diets, or the fasting diets. Let's look at fasting, for instance, or the elemental diets. The elemental diet essentially infuses the elements required for existence, basically in a very basic form through amino acids, carbohydrates, and fats. It essentially breaks down the essentials for life and then bypasses the gut. Okay, and you're receiving it directly into your fundamentally your circulation. So you're resting the gut from that perspective, but additionally, you're then nourishing your body through very, very simple substrates for existence. Now, you can't adhere to that because we need to eat. I mean, in Maslow's hierarchy of needs, one of the things that we've got is an appetite. We've got hunger, and so that's important for existence. So we can't theoretically keep people on elemental diets long term, but the reasons they work is that you're fundamentally resting the gut. You're probably removing the irritant which is coming from food. You've eliminated all the hyper processed foods, and you're just basically giving someone the basic elements for life, and the gut's being rested, so it recovers. And fasting works the same way. Say you take someone with adequate fat stores and they're given the necessary ingredients for life to be sustained. They can burn their energy. We know people have fasted for many, many months if they've got enough fat stores. I think it's just a form of gut rest. It's got to be, people have to be a bit cautious about fasting excessively and so forth, and specifically in this modern era where we've got issues related to under-muscled individuals with low bone density and so forth. I don't think the trick is to punish the body through fasting, but rather to nourish it. And so the question is, how do you nourish it? How do you nourish it is the fundamental question. And I think we can talk in depth about that a bit later, but there's no doubt that eating nothing at all is sometimes better than eating the standard Australian or standard American diet. And that's why people feel better with their fasting. But I don't think it's something that's sustainable or people can adhere to long term.
Yeah, absolutely. And, like you say, this is resting the bowel and eliminating, eliminating, certain factors that can be irritants, which does suggest that there's something that we're eating that is causing the problem, and you eliminate that, remove that, and this is causing a problem. So in your experience, what would be sort of the ideal diet, for gut health, for your patients and just for the general public?
Yeah. I think it's sad in a way, and I think you and me have spoken before, just on a personal level, that we separate a human being into organ systems, right? Like, so what is the best diet for gut health, for optimal gut health? Well, my response to that generally is the optimal diet for gut health is what is best for your overall systemic health, right? Like, it's as simple as that. Yeah. I don't necessarily measure microbiomes or do the fancy testing look at people's metabolic, the microbiome signature and so forth, I don't find them particularly useful. I find them very difficult to interpret. I think I don't think anyone knows what the right gut microbiome signature is. However, I will say that the right microbiome is probably the one that allows you to be metabolically flexible, the ability to burn both sugar and fat when needed. I think it is the diet that allows you to sleep, the microbiome that allows you to sleep well at night, the microbiome that allows you to maintain your muscle and bone density. It's the one that allows your HDL to be at really good levels, your triglycerides to be low, your blood pressure to be maintained, your insulins to be kept within very sensitive range. This is what I fundamentally believe is right for your gut microbiome, that overall that you're systemically well. If you're systemically well, it is very likely that your gut is working well. You'll find that when you improve people's metabolic health, and we tend to do it through low carbohydrate diets, which are very high in protein, a lot of their gut issues just go away. They really resolve. And so I've always made the point that potentially gastrointestinal symptoms are metabolic syndrome in evolution, many years before the hallmarks or the four horsemen of metabolic syndrome come into fruition. I think in medicine, you and me have been taught to separate organ systems out, that people are made up of multiple organ systems and you combine them to make a body. But the reality is we're a living organism where all these systems are interconnected, interwoven, and we cannot separate them.
Yeah, well, yeah, I would definitely agree with that. And you know, it is straightforward and makes sense. And if you think about it on those terms, you know, that's obviously correct. You know, we are an organism. You know, we're not a conglomeration of random parts. And so, you know, that's generally when people ask me, well, you know, is carnivore, you know, carnivore is good for this, but, you know, is it good for that? And is it good for this other thing? And is eating meat good for this, whatever? And what's about your gut biome? And what about your cholesterol? And I just say, look, you know, from what I can see, from the evidence, I'm eating in a biologically appropriate manner. And so whatever my gut biome is, I'm pretty happy that it's what it's supposed to be. I don't know exactly what it is, but I'm doing very well. And from everything I can see, I'm doing things in a biologically appropriate way. And so I don't need to micromanage little things. You know, my cholesterol, my HDL is high, my triglycerides are low. Last time I checked, my LDL was slightly higher than, you know, the standard range that we look at, which is, you know, based on you know, incorrect data and fraudulent sort of information. So they said, well, that's a little high, but, you know, I don't actually care because that's physiological for me. I'm just taking that for, you know, I'm taking that with a bit of faith, but I think that the evidence that's been coming out has been backing that up as well. As far as you know, you're giving people sort of a low carbohydrate, high protein diet. What do you find? What do you find with fiber? You know, obviously, this is something that so many people talk about when you go to a more, you know, animal-based nutrition source. People say, "What about your fiber? What about your fiber?" Which you know, I don't think is necessarily something I need. I haven't had it in I don't know how many years, but what do you find? Because some people, this is actually classed as an essential nutrient, which is kind of crazy. Well, at least I think it is. Maybe you might think it is essential, but what is your opinion and experience with fiber?
Yeah, sure. I mean, a lot of health professionals and dietitians use it as a panacea, that high fiber diets are what you're supposed to do. And I'll kind of never forget this experience where I took my elderly diabetic grandmother, who's subsequently passed away, and I remember she used to struggle with difficult to control sugars, and she was one of the big reasons why I kind of was motivated to do things better as a doctor. Taking her to her cardiologist, and she said, "Listen, my sugars are just all over the place. Like, what should I do?" You know, at that time she was suffering fragility fractures. She was clearly sarcopenic, under-muscled, had a really poor reservoir from which to store the excess sugar that she was consuming, or the excess carbohydrate. And he said to her, a high fiber diet. I'll never forget that, because here's a person who's fundamentally falling to bits. This bag of protein, basically protein and fat, who was failing to meet a protein requirement, and that was the advice given. Now, that's a common scenario. You'll see it every day in healthcare, where high fiber diets are used as a panacea. Is fiber a problem? No, it's not a problem. And there's a lot of inter-individual variability there. I mean, I personally myself consume it. We've spoken about this, Anthony. I enjoy things like fruits, you know, from a nourishment perspective, from a taste perspective. But what I am very cognizant is of the fact that there are many different types of fibers. There's soluble fibers, and then there's insoluble fibers, okay? So soluble fibers, generally like the types found in fruit, generally your colon receives that, and the gut microbiome that's present in the hindgut or your colon ferment that, create a fuel out of it called a short chain fatty acids, which is butyrate, and basically use that as a fuel for your gut. Now, if you've got excess levels of that, some of it can be absorbed into the portal circulation, into the liver, and sent out into the periphery. But I think the modern human being's gut microbiome, for reasons we've spoken about before, is really, it's not optimized well for it. And I think a lot of people now struggle with fiber, both insoluble and soluble. Insoluble fibers, which are found in a lot of these plant-based food sources, which our body can't break down and our microbiome can't ferment. So often it just comes out the other side. People think it's like a scrubbing the colon dry, but the reality is it accumulates a lot of water, it creates a lot of gas, and some people are genuinely uncomfortable with it, and some people, believe it or not, paradoxically can cause constipation. So you've got to personalize nutrition for people. If someone feels that they're struggling on fiber, well, you've got to tweak the diet, not just sort of force it down them if they're suffering gut distress. I'm a big believer in personalized nutrition. Now, how does someone like yourself nourish your colon with butyrate? Because that's what the colonocytes need. How is Anthony able to nourish his colon? Well, the way you're potentially doing it is you're supplying your bowel through your systemic circulation of production of ketones through burning your fat. You produce beta-hydroxybutyrate from the breakdown of your own fat that is in your own circulation, which then enters the colon through systemic circulation. And a lot of people on low carbohydrate, even low fiber diets, still find that their bowels move absolutely normally. It's just with less bulk, because obviously the fiber content isn't there, which is being passed out as waste. Now, is that optimal for a human being? The data would suggest not, because often the standard Australian diet or the standard Western diet is low in fiber. There's no doubt about it. You know, a high fiber diet in replacement of that would be preferred option. But you know, there's many nuances to how you attract this there. If you were to look at optimizing one's diet, fiber is not a nutrient. I think it is really important to point that out. Fiber is a substrate that your gut microbiome can utilize to produce a fuel for you. As human beings, historically and classically, only 2% of our fuel requirements come from that process of fermentation to release butyrate. 98% of our energy comes from other sources. Now, beyond that 2%, it's impossible, physiologically impossible for your gut to produce what is required to run a person. So a high fiber diet is not necessarily energetically plausible for a human being. Say you're a horse, 50% of your daily energy requirement will come from short chain fatty acids fermented in your hindgut. If you're a gorilla, but potentially about 20%. If you're a pig, about 6%. If you're a dog, about 4%. For humans, it's less than 2%. So what does that tell you about us as a species? That we're less dependent on fibrous plant material or fruit material than most other species in the world. Because I think as human beings, we have a quality brain, and we nourish that brain and the rest of our body through quality foods, through quality carbohydrates, through quality fats, and through quality protein, which comes back to my initial point, and a very simple point that I made, that this is all really about eliminating the processed foodstuffs and aiming for quality whole foods. with the caveat that we prioritize our protein intake in particular. I think there is no doubt about it. Human beings through history have always prioritized protein first, but we live in an era where protein is demonized, animal proteins in particular. So you'll see that the percentage of protein in people's diet is shockingly low. I mean, we're talking in America, they're made out to be big meat eaters, but yet their protein intake ranges from something like 8 to I think about 15 to 16%, which is abysmally low. I think for the standard individual with normal kidney function, keeping protein at 35% at least, it's kind of a no-brainer.
Yeah. And then have you noticed, obviously, when we, like in sort of people like diverticulitis or different sorts of, bowel conditions, we want to, again, rest the bowel. So they generally recommend, low residue diet, so a low fiber diet. And so this can obviously, this to me suggests that the fiber can be irritative in those contexts. Do you find that there is a problem with too much fiber? Some elderly people might have neurogenic colons, and this might slow down the motility. And obviously, fiber was suggested originally to increase motility, give your gut some bulk to move this around, and so it wouldn't dry out as fast in your colon. But as people age, the motility just goes down anyway. And have you noticed that this can like you say, paradoxically cause constipation or even obstructions and other sorts of issues?
Yeah, absolutely. I think what we know is fiber, fermented, in particular soluble. If you overdo fiber, say someone wants to overeat fiber, they'll generally get bloated with it. The bloating comes from the intra-abdominal gas, basically colonic production of methane through the fermentation process that the bacteria undertake. The methane, we know, Anthony, is a potent inhibitor of gut peristalsis, which means gut movement. So a lot of people with bloating generally will get constipated. They'll get gastroesophageal reflux because of poor gastric emptying and delayed gastric transit. The acid tends to sort of go up and irritate the esophagus. It's not ideal to create huge amounts of methane in our gut. We're not built for that. We're a species built for absorption in our small intestine. That is what separates us from so many other species in the animal kingdom. We are built to absorb quality carbs, quality fats, quality protein in the small intestine, and do a little bit in our colon. We ferment a little bit, and that allows us to be extremely flexible, right? But here we have a dietary paradigm pushing colonic-based digestion, as in eat more fiber, keep protein low, and obtain your fuel through short-chain fatty acids, which we know that there's a physiological limit to how much our large colon can produce. So it is out of keeping with what we've been evolutionarily trained to do. Now, something like a sweet potato, for instance, I find that a really good substrate in the context of the training that I do. I like fueling my body with carbohydrates prior to a workout. I know you're very different. That substrate, that quality carbohydrate that I'm receiving also comes with a bit of fiber, and that fiber is generally soluble, and my bowel can use that. But at the same time, I've been able to extract starch from that sweet potato in my small intestine and assimilate that as glycogen into my muscle, into my liver. Now, it makes no sense to me to just consume pure fiber, which lacks any other quality nutrient that goes with it. This is the thing: when you're eating foods in their whole food matrix, you're generally going to, hit all the targets quite comfortably.
Yeah. And you talked about, obviously, especially, the standard American diet, standard Australian diet, you're going to have far too little protein. And I know you've spoken about before, certainly in our, the debate that we were in, the carnivore versus vegan debate, you spoke about bioavailability. Obviously, that can be very different. Can you talk about that, the differences in bioavailability of different nutrients and proteins in meat versus plants?
Yeah, absolutely. Look, I think people assume that there's calories in a food. The calories go in, then we extract those calories and we get on with life. It's not really about calories, it's about nutrients. I think calories are a kind of a side effect of food. I think if I was to really simplify this, Anthony, I think people should eat to constitute turnover. Like our body's turning over cells, gut lining, mucus linings, like everything, hair, skin, it's turning all that over. Now, what is that that's being turned over? It is fundamentally protein. So protein should be counted as not an energy source, because it's a fairly poor energy source. Our body struggles to convert that to glucose. Some people are more adept at it than others, but others do struggle with that process of gluconeogenesis. Protein is turnover. It's fundamentally building blocks for our body. It is non-negotiable, and it should be eaten in high amounts. Now, you can try and do that through plant proteins, but there is no question about it. There is no debate that plant proteins are harder to extract the proteins out of their matrix. Now, they don't let it go that easily. There's a lot of anti-nutrient factors as well, which you've spoken about on multiple podcasts in the past, and I agree with you on that. They're less bioavailable to the human being. Now, a lot of people in the plant-based world get around that by using commercially available proteins, such as pea protein, but you think of the process that is required to extract protein out of peas, the chemical experiment that must entail, the chemicals that must go into strip and to hydrolyze that protein. I think, and that moves away from that whole food paradigm that we're really trying to preach. So yes, it is possible to get proteins out of plants, but it is a less readily available source. Additionally, we've got to remember a lot of these proteins, like beans and black beans or whatever, chickpeas, lentils, they come with carbohydrates that may not necessarily be absorbed well. These are things like polyols and fructans. These carbohydrates end up in the colon because they're not absorbed well. They're fermented by the gut bacteria. They create a lot of gas. Create a lot of distress for the person. They end up in my office complaining of gut-based issues. So it's like, well, do you want to survive, or do you want to optimize your survival? And do you want to have quality of life? And that's what it comes down to. There's no question, if you wanted to do a combination of animal-based foods and plant-based foods, that's fine, that's great. I've got no argument with that, but don't demonize animal-based foods, which are clearly the most bioavailable source of protein. To say that plant proteins are better, that is incorrect and scientifically inconsistent with anything that is available in the literature.
Yeah.
Therein lies the issue. Now, the choice to power your body through fat and carbohydrate, that really is dependent on the individual. A person like yourself is clearly well adapted to fat and suited to it, and your body thrives on it. Go for it. And there is other people out there that are lower in fat, higher in carbohydrate. And often these people, you'll find, if they're doing it properly, the carbohydrates tend to be higher in quality. Ancestrally consistent foods like tubers and root foods and stuff like that. And some people can tolerate. Most people can tolerate them, well, some can't, obviously. And for those, we can make exceptions. But you choose your fuel of choice. That's fine. Fat or carb, but I think protein, you cannot negotiate on that.
Yeah, but yeah, that's a very good point. You do need just a certain amount of protein, and it matters where you're getting that from. It is when people say that we are herbivores and that this is our natural food source. It is kind of funny that they can make that argument when you have to use an entire chemical lab to extract basic protein and nutrition from peas. I mean, obviously, if you can't do it, if your body can't do it, then your body's not designed to do it, and it's just that simple.
Absolutely, and it's the same individuals that having to take supplements, often having to inject 3 monthly B12 injections. It's like, it's very well to say that you're plant-based, and I support that. Like, if people want to do that, that's by them, but do not push the idea that this is evolutionarily consistent for us, because it isn't. It's false. It's false to state that.
Yeah, I'd agree. So last time we saw you, we went for steaks, and we talked about your nutrition. You were heavily meat based. Also, again, thank you for the steaks. I owe you. Next time you're in Perth, it's on me. And so you're mostly meat based, but like you say, eating some sweet potatoes, which I think in like the keto community, that's something that people have used for a long time and found much more beneficial than normal potatoes, which I don't see. I see why that would be. Obviously, potatoes are nightshades and have solanine and have other factors in them that wouldn't be as good as a sweet potato. What where are you at now in your diet and your training, and like, take us through a day in the life of Pran?
Yeah, sure, Anthony. I mean, what I do works for me, and I'm not necessarily suggesting that other people do it, but I can give you a snapshot of it. Obviously, we spoke about our diets, and our diets fundamentally are very, very similar. I think we prioritize quality meat, and we're both of the belief system that ruminant meat, such as beef, is the way to go. I eat a lot of deer and also goat. Which I think are quite healthy sources of lamb as well. My priorities getting my protein targeting for the day. So what I generally do, I would have a black coffee. I enjoy coffee. Whether or not that's necessarily suitable for everyone, I'm not sure, but I generally enjoy black coffee prior to a workout in the morning. And my first meal is generally around noon, 12 or 1 o'clock. I generally have 3, 4, sometimes 5 eggs, depending on how hard I've worked out, and a side of lamb. I might have a little bit of avocado or something like that, with some water, lots of salt. And then my second meal is at dinner time. Generally, it'll be some sort of ruminant food source with sweet potatoes. I tend to tolerate potatoes quite well. I think growing up in a third world nation in Sri Lanka and also in Africa, I've got a pretty well adapted gut microbiome, I think, for potential ability to deal with toxins. So I tend to tolerate potatoes and I enjoy them. So I'll have a little bit of that as a fuel source. And then generally at nighttime, for if I get a bit of an energy hunger, I generally satisfy that with fruit. Things like mangoes and peaches and stuff. I enjoy the taste of them. Are they necessarily ideal for maintaining low body fat percentage? Perhaps not. But again, it comes down to, you got to have a little bit of enjoyment and sustainability in the diet. So I enjoy that, and I'm sure they come with some valuable nutrients as well. And I generally finish it off with a glass of a good quality non-pasteurized milk, a great brand of milk called Made by Cow. Shout out to those guys. They're amazing at what they do. It's old school milk. And that's my diet. And I kind of rinse and repeat that. And people say you need to eat the rainbow or you need to have variability in your diet. Well, I'm 40, heading to 41 this year and doing pretty well on a very monotonous diet. And, it's kind of the proof's in the pudding, right? Like if you're able to train, able to maintain high testosterone levels as a man, if you're able to have good clarity of thought, good mental health, good physical health, and keep a low body fat percentage, and all your other parameters for metabolic health, such as HDL, blood pressure, and insulin resistance, visceral adiposity, all of that, if that's maintainable, who can argue with that? I'm not going to go out and send out a gut microbiome analysis to see if my gut microbiome is doing well. It's sort of like just got to be sensible about our approach to things.
I think that's a good way of approaching it. Obviously, there's a lot of people that have come to carnivore specifically because they have quite serious illnesses, and so they would be more sensitive to different sorts of foods and so forth, and they have to be a bit more careful. But the majority of people would be like yourself and myself, who don't really have much of a problem with it. Now, is it optimal? Maybe not. I wouldn't think it's optimal as in the best you can absolutely possibly do. But, I've done that for years. I played professional sports. Half my career was eating like that. So for me, it wasn't, to get away from a disease or an illness. I felt fine. But I like living optimally, and I like that sort of feeling. But obviously, I try to tell people, eat whatever the hell you want, But, if you're having it, but when people come to me specifically, how do I optimize my life? That's what I suggest. And when people say, I'm having these sorts of issues and these diseases, I can say, well, that is something that has been, shown in various studies, depending on what it is, to be beneficial to, these elimination diets. But yeah, that's great that, that you can, still, promote, a meat-based diet and the importance of meat, and, but still have a realistic understanding of it and in your own self, and just be like, well, this works for me. I'm not, it's not detracting from my health all that much. And so, I like to do it, which I think is totally fine for people to do. But yeah, when I like I just like feeling absolutely as best as I can. And when I eat sort of other things, it doesn't necessarily change too much, but I'll have something will sneak in, and I'll just feel a bit crummy for like 40 minutes. And but not even that bad. It's just sort of my nose is stuffy, a bit itchy, and it's just kind of like, oh, well, I don't like that. Or maybe like rice. I certainly have problems with rice and beans, even just get a little bit in my diet, and I'll have like very bad back pain for 4 days. I remember the last time I ate rice and beans, I had it was on a meal. I went out, and it just sort of stuck to some of the meat that I ordered, and I tried to scrape it off, but like it got a bit on there. And I remember it was early on when I rediscovered carnivore, and I just sort of thought about it. I was like, well, maybe I'll just like take a spoonful and just like take a bite of this and just see how it affects me, because I was interested in how these things affect me. But I said, no, I don't want to do that. That's a slippery slope. I might, keep doing that, and I don't want to do that. And so I just left it with just the little bits and pieces that had stuck onto the meat. And even that, my back was absolutely in pieces for 4 days after that. Couldn't train properly, couldn't get out of bed properly. I felt like a broken old man. And, so those sorts of things were reinforcing for me just to stay the hell away from it. But
yeah, it almost sounds like an immunological reaction that you're getting against that. And again, this is the thing, we've got to be able to personalize nutrition for people, right? Like it's detrimental to tell a person like you to eat the food pyramid, right? Yeah, because if you're feeling less than optimal doing that, well, what are we doing just to appease a government guideline? I think we've got to be able to tailor a diet according to what the person can tolerate. We're all different, but there's no doubt about it. We as a species are very well adapted to meat. There is no question. That is not just specific people in the world. We're talking us as a species. And I think it does a disservice to our ancestry if we dispute that.
Yeah, I think that you raised the issue of the government guidelines and so forth. I was actually looking at this the other day. In America, 6 out of 10 people have at least one chronic disease or metabolic syndrome, something like that. And then the dietary guidelines, U.S. dietary guidelines, say specifically on it, this diet is not meant to treat people with disease. I was like, okay, so this is completely inappropriate for 60% of Americans. So they're just tacitly stating that this isn't necessarily the right diet. This isn't actually the most healthful diet out there.
Well, it's interesting, and the same with the Australian dietary guidelines. They specifically state that this diet might not be for someone with chronic illness, which is the vast majority of Australian adults. It's not necessarily for elderly and for growing people. So it's like, well, what are we doing here? The vast majority of the population is disease with some sort of metabolic ailment, then we should really be throwing it out and starting from scratch. But that'll never happen, because like anything else in life, everything has become a political issue, and it's been heavily politicized, and diets heavily politicized. We're living in an era where climate change, I think, will drive a lot of policy making, in particular with the way we eat. So it's interesting times ahead, Anthony. I'm not looking forward to them. Let's put it that way.
Yeah, definitely. Well, thank you very much. I'm just conscious of your time. I know you have some patients coming up, but thank you very much for coming on. It was great to talk to you. It's always great to talk to you. Tell us where we can find you, and where people can find you, and if they're in Sydney or need your services, how do they get a hold of you?
Thanks, Anthony. So I've got two services that I'm sort of built. My gastroenterology service is called the Centre for Gastrointestinal Health. We're located in Castle Hill, in Gregory Hills, and also we've built a new service in Bowral. So that's staffed by a lot of my team of gastroenterologists. Additionally, we're building a more nuanced service and built one called the Centre for Metabolic Health. The website should be out on that. The Centre for Metabolic Health looks to optimise metabolic health, and we've got a whole team of dietitians, about 6 dietitians. Additionally, a lot of physicians, internal physicians, general practitioners with an interest in nutrition that run that service. So I look forward to that service building over time, because that I feel will really help restore metabolic health for people, and we're going to do it as a team alongside the dietitians. I'm active on social media, on Instagram and Facebook under my name, Dr. Pran Yoganathan, but I tend to get shadow banned a lot for a lot of my posts. I don't think a lot of our views on nutrition are supported by mainstream media, and I think it's going to become increasingly difficult to get the message out, because we're so reliant on social media to communicate to the wider population.
Yeah, absolutely. Well, I encourage everybody to go to your Instagram. I've always really liked you. You're pretty prolific on there. You have a lot of very thought-provoking and very deep posts. I've always really enjoyed that, and not just to do with diet and so forth, but just everything to do with around the world. Very interesting quotes, historical quotes, and comparisons and so forth. So I encourage everyone to go to that. And if you need a doctor in Sydney who understands the importance of animal-based nutrition, please see Dr. Pran. Thank you, sir.
Thank you very much, Anthony. And I'd love to do it again with you sometime, mate. And look forward to seeing you in Perth.
Absolutely, buddy. See you soon.
All right. Thanks, mate. Bye.